If you experience pain around the kneecap during stairs, squatting, or running, this taping technique may help by improving patellar alignment and reducing symptoms during activity. Welcome to Sport Rehab Playbook. In this video, we will review how to perform a McConnell tape job. You'll need some adhesive spray applied to anchor zones, a fixation tape for your anchor, such as 10 cm wide Hypafix, and rigid tape such as 1.5 inch Leukotape. Begin by palpating the patella to identify its borders. Apply a strip of Hypafix directly over the patella, extending from the lateral to the medial side of the knee. An on-screen illustration will be used here to help show the position of the patella. Anchor a strip of non-elastic tape on the lateral border of the patella. Apply a medial directed pull while simultaneously guiding the medial soft tissue toward the patella. Secure the tape over the medial femoral condyle with minimal tension. In most cases, McConnell taping involves a medial glide of the patella to address lateral malalignment. Apply a second strip just inferior to the first, using the same technique to provide additional medial support. This taping technique is meant to influence patellar positioning and modify patellofemoral joint loading during movement. Thanks for watching, and see you in the next video.